Now, the Minister of Health is advising that 20 additional persons have tested positive for COVID-19. This brings the number of active cases to 1,492. There's been one more death, taking the total number of deaths to 34. The latest figures came from samples taken between August 28th and September 5th. There are 109 COVID-19 positive patients in hospital. 7 persons have been discharged, bringing the total number of discharged persons to 724. The total number of positive cases since March is 2,234. Well, COVID-19 has seen an increased awareness in the public domain on incidences and potential for domestic violence. The PAHO WHO Advisor for Violence Prevention, Britta Monica Bayer, told a recent panel discussion on the issue that this has been an ongoing challenge for the region. She says 1 in 3 women are subjected to violence by an intimate partner, and the ongoing pandemic is not making its management any better.
We are living in a situation where there's more stress, more anxiety, potentially greater abuse of alcohol, drugs, a greater burden of domestic tasks on women in families, school closures, high risks of losing jobs or other economic or social worries. All of this are potential risk factors that can increase the chance of violence happening. At the same time, we know that protective factors for violence are reducing, such as there will be, for many of us, less contact with family and friends.
She says this should be of serious concern to most regional legislators, since getting data during these times is difficult. Her advice is for the relevant agencies to pay attention to other services being used as an indication of a possible uptick in home-based violence.
For example, increases in help-seeking, increases in calls to helplines, increases in reports to the police that suggest a potential increase in risk or a potential increase in demand for support, and that makes us very worried. At the same time, we also see in other locations and other countries sometimes pauses in these kind of help-seeking, pauses in the number of calls or reductions in the number of calls or reductions in the number of service users. And that makes us equally worried. It doesn't mean that violence reduces. It means that there will likely be more disruptions in the number of support services or new access barrier for survivors in needed support.
Well, the United Nations General Assembly has endorsed a resolution initiated by CARICOM urging special attention by the international community focused on battling non-communicable diseases. CARICOM's initiative against NCDs arose out of wide-ranging recommendations in a 2005 report by a Blue Ribbon 11-member Caribbean Commission on Health and Development. The commission was headed by Sir George Allain, a former director of the Pan American Health Organization and current Chancellor of the University of the West Indies. The endorsement by the General Assembly on the epidemic of non-communicable diseases that are major contributors to deaths across the region and beyond supports a proposal for a high-level meeting on NCDs with participation of heads of state and governments in September 2011. Trinidad and Tobago, Jamaica, Guyana, and Barbados are considered to have high rates of non-communicable diseases that add to their social and economic development challenges, with budgetary expenditures running into many millions of dollars annually. 2 of the CARICOM prime ministers who have been actively involved with the community secretariat in aggressively promoting international support to battle NCDs, which resulted in the historic endorsement at the UN, were St. Kitts and Nevis's Dr. Denzel Douglas and now deceased Trinidad and Tobago's Patrick Manning. As recalled by Dr. Karen Seeley, PAHO WHO Special Advisor at the UN, Prime Minister Manning was a prime mover for the Special CARICOM Summit on NCDs in 2007 and subsequently in internationalizing the issue when he hosted the 2009 Commonwealth Summit of Heads of Government.